Greetings, my friends. Welcome to this wonderful episode of Heroes Headquarters. Today, we are featuring an early age onset survivor of stage 4 colorectal cancer, Natalie Lipschultz, and her GI medical oncologist, Dr. Howard Lim from the BC Cancer Agency in Vancouver. The episode will highlight Natalie's inspirational journey founded entirely on courage right from the get-go, and the patient-centric expert, Dr. Howard Lim, who supported Natalie every step of the way, encouraging her to participate in the shared decision-making process, allowing her to make those critically important, informed decisions regarding her care. The two developed a lovely patient-oncologist relationship, and as such, it is our pleasure to be bringing this episode to you today that will encourage you and bring you much hope. Sit back, my friends, and listen to how a young woman overcame the odds with the help of an extraordinary clinician. We are pleased to have this session moderated by Mr. Ryan Clark from Eversana Canada, who does a great job of facilitating the discussion. Thanks very much.
Dr. Howard Lim is a medical oncologist at BC Cancer Agency, Vancouver, and a clinical associate professor in the Faculty of Medicine at the University of British Columbia. He is also one of the co-leads for competency-based medical education implementation at UBC. Dr. Lim specializes in gastrointestinal malignancies and is actively involved in clinical trials, ethics, health economics, and genomic-based research. A valued member of CRAN's Medical and Scientific Advisory Board, we appreciate Dr. Lim taking the time to join us today. In October 2019, Natalie Lipschultz was diagnosed with stage 3 colorectal cancer after having had symptoms off and on for a few years, as well as some frustration with getting that initial diagnosis in the healthcare system. Post-surgery and chemotherapy, Natalie was released from care, and shortly after, she and her husband got pregnant with their first child. After the birth, a pain that had begun during the pregnancy persisted, and ultimately 2 small lesions were discovered on Natalie's liver. That's when she was referred to Dr. Lim. So Dr. Lim, welcome. Let me begin with you. Can you tell us a little bit, just in general, about your practice and how you support and help your patients through their journey?
Sure. So as you said, I'm a medical oncologist here in Vancouver, where I'm primarily do gastrointestinal cancers, mainly upper GI as well as lower GI. In terms of supporting patients, every patient requires different levels of support, information. So one is the treatment plan itself, and 2 is trying to figure out what exactly do patients need. In Natalie's case is very similar to what we see with a lot of our younger adult patients. And here at BC Cancer, we are trying to establish a young adult program to support, because their needs are very different than what we normally see in GI malignancies, where normally the median age there is they're in their late 60s or early 70s. And Natalie just had a baby, and she's trying to start her life, and she's been given this diagnosis. So her needs are very different than probably what we're typically used to within our practices. And that's where it's really, and I think Natalie will attest this, we have a lot of long conversations in our appointments and lots of phone calls and discussions, but really sitting down and talking about what her needs are and trying to work through that. And I think that's more an individual basis thing that we try to do here at BC Cancer, especially with the younger patients, and then figure out what supports we can give. As Natalie will attest to, sometimes we are limited in terms of what supports can be given as well in terms of this patient population. We're trying to improve on that. And we are fortunate that there are patient advocacy groups and support groups out there. And so it's really trying to figure out what do patients want and what does their journey look like. And I'll admit I'm more of a passenger with respect to that, or the person in the right seat of the car, just with the map, saying maybe we should try going this way. But for the most part, Natalie pretty much drives the ship, I'll be pretty honest. So.
And you talked about, certainly I can appreciate the needs of younger patients being different than older patients, but can you talk a little bit about some of the needs that perhaps you've identified in dealing with younger patients and have tried to sort of fulfill that might differ, from some of your older patients?
So the number one issue is, especially when with younger patients, we have to talk about fertility sometimes. Do they want to have family? I mean, a lot of it's about family planning, or they may have young families. And in that case of being a young parent, how do you then balance your appointments? And I admit our appointment system is not the greatest, where we kind of let you know of your chemo appointment the last minute. How are you supposed to get childcare? How are you supposed to plan all this stuff when you've got a young child who's dependent on you? And then how do you plan forward, especially when you've been told you have stage 4 colon cancer and you start reading statistics? It's very scary as a parent about then thinking, will I be alive for my child? Like, there's so much different emotion versus the other way. When we have older patients, they're kind of, oh, well, it's my life. It's a very different palliative experience where, and not saying that Natalie is palliative, thankfully we've gotten rid of her cancer, but to have those discussions from that parental point of view about how do you focus on your child, your family, and yourself all at the same time is a massive undertaking. And I think that's one of the most difficult things. And we don't help with those logistics to make her job easier, unfortunately. And I think that's part of the problem with the system, to be quite honest. And we are working on that, but it's still a work in progress.
I see. Thank you. I appreciate that. Natalie, welcome. And why don't you just begin perhaps by telling us about your story, about your journey?
Sure. So I will try to condense it a little bit. There's a lot of nuances and details, as I'm sure there is with every patient. As you mentioned, it was October 2019 that I was originally diagnosed with stage 3 colorectal cancer. And what I really do want to emphasize is one of the challenges that I had personally, and I remember going back quite a few years before I was diagnosed, was having some GI issues that as a young person, I didn't know what it was. I feel like we always justify it. We brush it off, as to, oh, it could be this or it could be that. I eventually did, ask, I had a GP at the time who I asked, and I remember going to 2 different walk-in clinics, within the span of maybe 3 years. And I was brushed off and told directly to my face, because of my age, because of your age, you can't have cancer. Can't. They say can't. We need to emphasize that. And they wouldn't do blood tests. They wouldn't do, in this case, it would have been a colonoscopy that would have caught it. They didn't exactly know where to go with me. One of the things that I really believe those doctors needed was education. I remember going into one walk-in clinic and saying, I was having some, GI issues for a few days straight. And he wrote down on a pad of paper, go to the pharmacy, get Imodium. And he told me I would get over it. And even my own GP at the time, I specifically said, I want cancer screening. I was 35 years old. I wanted cancer screening. He looked at me and he said, well, our MSP doesn't pay for that. I'm sorry, I can't. He said his hands were tied because of our healthcare system. So basically what ended up happening was I was getting lower abdominal cramps kind of on and off for a couple of days. And one morning I woke up and it was so painful, I couldn't stand up. My husband rushed me to the hospital at Royal Columbian Emergency, where they figured that basically an ovarian cyst had ruptured. And I was told this was pretty normal for, females of my age. When they did do the blood work, though, they realized my hemoglobin was so low that they were actually pretty, they were pretty sure that I shouldn't have been able to stand up, is what they told me. It was so low, they didn't want me to leave without blood transfusions. I didn't know what was going on at the time. They didn't know what was going on at the time. Basically, what it led to was a series of CT scans, MRIs, blood work, a whole bunch of diagnostic testing to try to figure out what was going on, until eventually they did give me a colonoscopy, and that's when they found the colon cancer. I was rushed into surgery. I think it was about a month after that. And because they had already done the diagnostic testing, they did know that it hadn't spread to stage 4 at that point. So they did rush me into surgery, and we got, everything out. And then in January of 2020, I started adjuvant chemotherapy at Royal Columbian Hospital. And basically at the time, there wasn't a conversation about, what to look for in the future, what can happen in the future. And I believe, to Dr. Lim's point, the younger and the early onset patient group maybe, has different needs, in that we're looking hopefully at a longer lifespan. We're wanting to live longer. So I think there needs to be, more talks about what needs to happen at 1 year, 2 years, 3 years, up to 10 years, 15 years, because that's all our hope. We're hoping that we're going to get there, obviously. I had shared that my husband and I wanted to try to have children. I wasn't told at the time that, if you're pregnant, you can't go through CT scans. We didn't talk about recurrence, things like that. So I think what happened as well is COVID hit in March of 2020. I was going through chemotherapy at this time, and one of them was oxaliplatin, which you do have to go into the hospital for them to administer. So at the time, basically they decided that for my safety, we were going to cut out the oxaliplatin and continue on with the oral pills. So, I did the monotherapy for a few months after that. After that, it was kind of like, you're fine, everything's great. Then my husband and I got pregnant, and of course our focus shifted to the pregnancy and now our daughter and all of that. During pregnancy, I was having some upper abdominal issues. And, basically, well, you're pregnant, so, it could be this, it could be that. I think it was about a few months after my daughter was born, and it did get really bad to the point that I ended up in the emergency again. When I ended up in the emergency, and they did some ultrasounds and eventually a CT scan, and my daughter was 5 months old at the time, they said to me, "We think that you have 2 lesions in your liver that spread from the colon cancer." And that hit me like a ton of bricks, to be honest. And I remember the doctor in the ER saying to me, I kind of asked him what that meant. And he said, "Well, I guess we have to see if they're close enough for them to do surgery. I'm really sorry." And he walked out of the room. And at that point, I started, getting on the phone to my doctors, to the prior oncologist that I had, which I had told she had moved to BC Cancer. I got on the phone with her. I got on the phone with anybody that I possibly could. And I started, advocating for myself, hey, I need answers. I need in front of somebody. I need to know what's going on, all of this. Eventually, I did get an appointment with BC Cancer, and that was when I was connected with Dr. Lim. So that's kind of where we pick up, I guess.
Thank you. I do want to ask you one question, though, just at the end, when you said, you were told this by your physician, as you said, when you were in the hospital, and you said, "I immediately started to advocate for myself." That isn't necessarily what everybody would do, or the reaction that a lot of people, I think, would have. Tell us I guess, why did you have that reaction? Why was that sort of your default, do you think?
I think, to be honest, my daughter being 5 months old was a huge drive in that. I need to know what's going on for myself, for her. I need to get this sorted out so that I can focus on her and be a mother. So I think that was my huge push. And at the time, I was feeling anger. I was feeling anger that I was dropped by our healthcare system. I slipped through the cracks, and I do believe COVID had a lot to do with that. I don't want to put the blame on anybody. COVID really obviously did a number on our healthcare system, and there was a lot of up in the air questions, around the world, obviously. And I guess, I had a 5-month-old daughter, and I was angry, and that drove me to get to where I needed to be.
I see. Thank you. Dr. Lim, I'm going to ask you about when you first met Natalie in a moment, but perhaps just for the viewers, can you tell us, as a clinician, is there any difference between your perspective when perhaps a what I'll call a typical colorectal cancer patient, as you said, perhaps a little older in life, presents with stage 3, and when somebody as young as Natalie presents with stage 3? Do you have a different perspective on that?
Yeah, I think it goes back to Natalie's point about educating primary care physicians, because most people think young people don't get cancer, and the data shows otherwise. We have younger and younger patients getting cancer. Unfortunately, our screening program starts at age 50. Moving it to age 30 wouldn't work so well, in the sense that we'd be screening a lot of people to try and catch a small cohort. But it's coming back to her points about listening to her symptoms. Now, sometimes they can be vague, and it's easy for me in retrospect to say, this is very clear. But certainly with persistent symptoms, gastroenterologists will do scopes in younger patients with symptoms that are concerning. And so it's about just telling gastroenterologists and getting the scope that she needs and getting those tests. So I think it is coming back to her point, really, that thought of having cancer on people's radar for younger patients, and we'll definitely get them in. I mean, we will try and expedite young patients as fast as we can. And I think I don't blame her for being angry, and that word that she uses, to advocate, because she was telling her story to the system that no one was really listening to her. She ends up in the hospital with a hemoglobin where people thought, how can you even be standing? And that's kind of a testament to who she is. She's just a strong-willed person. But that's a story we often hear, is that there's these symptoms, they've gone on, they end up in the emergency department. Yes, we're not perfect, and I don't think we ever will be, but I think we certainly can still strive to listen to people and try and make sure that system is better. And unfortunately, also, Natalie didn't end up in a system where COVID hit, and I think then your oncologist moved. Like, there were a lot of moving parts that you had to overcome. So I think that's another part, I think, of Natalie's story. If there was probably more consistent care and something more longitudinal, I think that would have been less bumpy for her as well.
Yeah, I do want to say that I do fully agree with that. There's a lot of challenges in what happened with my story, and Dr. Lim is right. If it was more longitudinal, I think, these things would have been caught earlier. We also had a baby in between, that was not something anybody was going to expect. I always say, I really wish that I had known the risks, but I'm going to be very honest. If I had known the risks, would I have her right now? And that's not a question to me. Like, maybe I would have done it anyways. We'll never know. But, that also threw a huge wrench in my particular situation. having a baby and what it does to your body too. So I do want to point that out, because I feel like that part for myself is fairly unique, that in between the stage 3 and the stage 4, I had a baby. So I want to point that one out as well.
Absolutely. So Dr. Lim, you called Natalie strong-willed. So tell us about when you first met this strong-willed person when she came into your office.
Well, yeah, Natalie's how she presents. She basically says it as it is and what she wants. I mean, we came up with a plan, and I think also she had come in reading a lot, as most patients do, and trying to advocate for herself. And so certainly going through all the different scenarios, because certainly with patients who have colon cancer limited to the liver, there are different ways to go about different approaches, surgery first or chemotherapy first, and different variations. And so we spent a lot of time, as we often do, talking about every single situation and different scenarios. And I think number one, that's normal in someone who, number one, I think you've had 2 other oncologists before me, and kind of was fumbling through the system. So I think, to be quite frank, my viewpoint is it took me a long time to have her really truly trust me. And my job was really trying to help her gain some faith in the system. In a system which already fumbles sometimes, it's hard to do that. But I think that's where I was trying to come from. Like, how do I help her build some faith in the system? And there were some stumbling blocks we had where I had to regain your faith. But I think that's where I came from, is how do I make sure she can have some trust in the system that we will try to care for her.
Yeah.
And Natalie was stage 4 when she got to you, is that correct?
Yes.
Yes.
Okay. And then can you just tell us, Dr. Lim, I know you've touched on it, but about her sort of treatment plan along the way, like since you've been treating Natalie?
Yeah. So our plan was to look towards so number one, because it was liver limited, the discussion was, can we get rid of the cancer in the liver? And hopefully that will generate a chance of cure, which is nice about colon cancer, is we can still resect out metastatic disease and there's a chance of cure. So number one, having that discussion with her, but I also still having a discussion about, future family planning. She had just had a baby. And so what is the effect of this on fertility? That there is a chance. And moving forward, how do we do surveillance, et cetera? A lot of it was focusing on how do we time the surgery, getting her to see a hepatobiliary surgeon, making sure that we're getting all those moving parts together appropriately. And I know Natalie had different questions. What about ablation? What about radiation? Like all the different techniques. And we went through all of that. And also, we're fortunate here in Vancouver, we actually have a liver tumor board. So her case gets presented. It's seen by all the radiologists, interventional radiologists, surgeons, myself, radiation oncologists. I think we brought your case twice because there's some imaging issues in the end that need to be clarified. But I think that was helpful for her to have these extra experts, because sometimes hiccups will happen with imaging and to clarify things. So I think it was to be, your point person really within the system.
Mm-hmm.
Now, Natalie, tell us about what it is. Tell us what it is about Dr. Lim that ultimately had you connect with him and build that trust that perhaps you either hadn't had or that had been lacking, with previous healthcare professionals up to that point.
I would say, so our initial meeting, there was 2 things that he said to me that still stick with me, that even when I have bad days, I actually try to remember that he has said them to me. Number one of the first things he said to me was, we have the chance to cure this. And he used the word cure, and he just did right now as well. And that stuck with me because at stage 4, when you're talking about stage 4, I don't know that a lot of people hear that, just based on statistics that I've read. And I know that's kind of a broad statement to say, but just based on statistics of stage 4, I don't know how many people hear the word cure. The other thing that he said to me was about the statistics. I had about 3 weeks, I think, to digest what happened to me from when they found the lesions to when I saw Dr. Lim. And in that time, I did what I think most people do, and what I will tell everybody out there that they should not do is start Googling things. And I started Googling statistics, of liver lesions and colorectal cancer and all of this. And the statistics, I'm going to be honest, are not on our side. So when I brought that up with him at our first meeting, what that number was, he said, "Oh, don't worry about the statistics. You are not a statistic. You are a person. You are Natalie. You are not a number." And that stuck with me. And, to this day, when I'm really scared and I have bad days, I actually remember his voice in my head saying that. And he's right, because of the way that my case presented. And as he mentioned, it was brought to the liver board, and I got to see a surgeon who then resected the disease. I personally did not fall into those statistics that I was reading about. And that is the dangerous thing about going on Google, is that it's too broad. Everybody's case is so specific. When you have a connection with somebody like Dr. Lim, Google doesn't take that into account. So, I obviously did the worst thing that I could do. And I read all of the things that scared myself. And then I think going forward, and since we've been working together, as he mentioned, I have read a lot of different cases. There is a group on colontown.org, and it is cases around the world, and people talk to each other. And you learn a lot about, what can happen in other countries and what can happen with other people's cases. Some of that is good and some of that is bad. Some of it is good because now you feel like, hey, I have these questions that I can write down. I read about this case and I want to know a little bit more about, the nuances in that case. So I think what I do is that I write a bunch of questions down based on cases that I have read or things that I know are happening in other parts of the world. And then what I try to do is then go to the expert, and the expert being Dr. Lim. So I don't want to take anything at face value because those people are not me. Those cases are not me. We're all very different. But what I do like to do is take my questions to him and then say, can you please help me understand this? And I think that's where my trust with him started. I think that thinking back, there isn't a single question that I've had that Dr. Lim hasn't at least tried to answer. And, he doesn't have all the answers as much as I wish he did, and I'm sure he wishes he did. He doesn't have all the answers. He doesn't know what's going to happen to me. That is the biggest question in my mind, and I'm sure in his mind. And if he could, pull out that answer for me, he would. But outside of that, every single question I've had, he's tried to answer to the best of his ability. And that really started my trust with him. I hear too many stories of other oncologists that either their answer is vague, they rush them out the door. There's, all these other, different things. And the other thing that I will say that helped build my trust with Dr. Lim is I don't think it's so in the room at BC Cancer that we usually have these discussions and talk. I don't think he even has a clock. I don't think I've ever seen him look at the computer to check what time it was. I don't think I've ever seen him look at a watch. I don't think he's ever said to me, BC Cancer has scheduled us 15 minutes, so you get this amount of time. I, on the other hand, also try to respect his time and try to limit the amount of questions that I have, because I would be there with him all day if I, if I wanted to. But, that being said, he's never looked at my notebook and said, how many questions do you have today? So, I think that really did build the trust. And as he was talking about, sometimes, for oncologists and for doctors, it's really trying to figure out, what does the patient need from them? And what I need from him is that trust in our system and answers to the questions that I personally am confused about. And, the other thing I have to say is I think that, I think as far as my husband is concerned, Dr. Lim's also his hero, because I go in there, he comes with me, and he comes with me to remind me of things. Dr. Lim and I talk about so many different things, and my husband doesn't always know, the nuances that I'm talking about, or the words or descriptions that I'm talking about. But then there's so much information that I want to know, and it's because of me that I want to know it. And then I come home and, something will set me off, and I'll just go, oh my God, what if this and what if that? And my husband goes, what did Dr. Lim say to you? Just remember what Dr. Lim said. And that's why he goes to the appointments with me, because then he will be like, remember when he said this, and he will pull it back. And I think that makes my husband's job a lot easier too, because obviously, he's the one that I share the most with, and I'm scared about what's going to happen and all that. And he always just says, until he has said to me so many times, until Dr. Lim tells you to worry, why are you worried? And he's always like, if Dr. Lim doesn't look worried, I'm not worried. And that's kind of like, he's equated it to, like when there's turbulence on an airplane, if the flight staff are not worried, why are you worried?
Oh, that's good too. Oh, I like that. Yeah, that's another good one.
That's what he always says to me. Like, he basically says to me, the day that we go into that appointment and Dr. Lim looks worried, that's when I'm going to worry.
Now, speaking of questions and answers, can you tell us, Natalie, about your connection with CRAN and how you came to get to know them?
Yeah. So I learned about CRAN after my liver resection surgery. So going through all of this, I didn't realize there was a patient advocacy group out there that I could work with, that I could also ask questions to, that also, took people's cases on and helped them, further educate them. I learned about CRAN through colontown.org, and colontown.org has a specific Canadian subgroup. And CRAN was honestly mentioned on there a couple of times. So I went to their website, and there was so much information there that I felt like I needed at that moment. I then reached out to them and started asking a couple of, very specific questions, and about, I guess, if things were to happen in the future. At this point, I was no evidence of disease, and I still am, thankfully. So I didn't need to start asking them about, second opinions or treatment plans or things like that. But I did, start getting involved in what they did, because I personally think that every cancer center across Canada should be promoting CRAN. I think that this is a website and a support system that is basically for the patients, by the patients. And I know a few other people that are patients that work with CRAN as well. I've connected with them. We have brought in other patients into our circle, and we are really trying to connect, especially the early onset group here in Vancouver. And I think we're just trying to give them hope. We're really trying to give them hope, to lean on each other. A lot of us have young families or wanted to start families, and we have that in common, and CRAN really brought us together.
Natalie, how old is your daughter now?
She just turned 2 yesterday. Yesterday was her birthday.
Oh, cool. Oh, wow. That's a great
Yeah.
age. That's awesome.
Yeah.
Okay.
And
And
I'm
I
also
trust, sorry, and I trust she's met Dr. Lim, by the way.
no, she hasn't actually.
No? Oh, okay.
Yeah. I might have showed him pictures at some point, but I feel like
Okay.
the setting at BC Cancer, I feel like is not one she should ever be exposed to. And I really hope she
Oh,
never will.
interesting. Okay. No, fair enough. Yeah, fair enough.
Yeah, I was actually just gonna say I'm actually very grateful because of my situation, because of my story, that she's been shielded to what happened to me. And she was too young to really understand when I was going through chemo and what that was like. And we all got COVID when I was in the middle of chemo too. We had dodged it for a couple of years, and then she got it and she was 6 months old. So obviously she didn't have any shots or anything at that time. Kids couldn't get them. So, it got passed through all of us. I tested positive for COVID, and the first person I called was Dr. Lim, and he got me the Paxlovid pills right away. And that was another, little stepping stone to the trust that I had with him, because he got me the medication right away. He also assured me that, with my blood test results that he had seen, and with the type of chemo that I was on, he really didn't think that I would be hospitalized. So he kind of assured me of that fact as well, because as I'm sure anybody can imagine, getting COVID while you're going through chemo is scary and it's not an ideal situation. So, there was that point in time as well that he really helped me as well.
Excellent. And Dr. Lim, can you tell us about your involvement with CRAN?
Yeah, well, largely it's been with Philomena. She's the one who recruited me when she started CRAN. And as you know, Philomena is also quite a powerhouse. So really it's on the scientific side, just from that medical aspect. There's a number of oncologists that support CRAN and try to see where we can help with that patient advocacy. So a lot of it is in combination with CRAN and Colorectal Cancer Canada, really about funding submissions also. So when new drugs are coming out, it requires both patient advocacy and physician advocacy for the funding mechanism to show what the value of that drug is, what the impact is. So that is also incredibly helpful. Patients really have a voice in terms of drug funding. And in fact, most of the time, the funding agencies will listen to your stories more than us, because we're always saying this should be funded, this should be funded. But hearing it from the patients themselves, that's the most important thing.
I see. And as we're sort of wrapping up here, Dr. Lim, maybe I'll just ask you sort of a final question. Do you have any words of wisdom for patients who are embarking on perhaps a similar journey to Natalie's that we've been talking about today? Anything you want to share in conclusion?
I think Natalie's highlighted, number one, it's about getting the right information and also at the right time. As you heard from her, she did Google like most people do, and unfortunately, there's just a lot of bad information out there that scares patients and is also incorrect. So I think it is important to educate yourself, but figure out that balance of how much information is appropriate and also what is that right information. And sometimes you don't need all that information right at the beginning. This is where everybody's a bit different. So I agree, like the education and advocacy for yourself. And I think those are the main things. And the other thing is, the honest truth is sometimes things are just beyond everyone's control. And it's trying to get used to that feeling of we're just going with the flow. That's kind of how the system is, and that's medicine. But you can still control on how you live, no matter what. Focus on who you are, being the person you are, because that's why we do all this treatment. I mean, we spent lots of money keeping Natalie alive, and we're going to keep doing that. But because we want her to be a mother, we want her to be a wife, we want her to be doing, I know you want to go back to pole dancing, so we want you to be doing that. Like, we want Natalie to be who Natalie is. And that's what we want for every patient, not a cancer statistic, but truly a person.
That's excellent advice. Thank you. And Natalie, the last word goes to you. I typically ask a similar question, sort of some piece of guidance, but you've given a lot of guidance. I think you've shared a lot today for our listeners. But as we touched upon when we were preparing and your remarks to us, you concluded your remarks by writing the 3 words: advocate, research, and educate. And so I want to ask you, why did you write those words? That's my first question. And secondly, what do those words mean to you in the context of what we've been talking about?
For sure. So I'm going to say why I wrote those words is because I want everybody to remember that this is your life. It's not anybody else's. You are in control of what happens to you, what happens to your body. And you have those decisions, and you have that right to stand up and say, I deserve to live. Nobody is going to tell me how I'm going to die. That's why I feel like advocacy is so important. Not a single person on this earth can tell you this is how you're going to die. And I don't believe anybody ever should have that power. And what I meant by advocate and research, if you really feel like internally something is not right, something isn't going your way, push for those answers. Push to get something done that maybe, initially you've heard a no, because it just might change your life. I personally know people and have worked with people on this patient advocacy side that were told no many times. They found different avenues. They researched, the proper information, the correct information, and found different avenues for their own situation. And it made a difference. And they are still here when nobody ever thought that they would be. So that's why, I say advocate. Educate, as I mentioned, I believe you do need the proper information. Everybody's case, as I said, is individual. Everybody's case is different. So, what I feel like everyone needs to do is try to gather as much information about their own case and then start asking questions. Question your doctors, question your specialists, question your GP. Initially, if you think that you should get tested for something specifically, I went through it where I just kind of let multiple doctors tell me that I was too young for anything serious. If you really feel like something is wrong, don't take no for an answer. And if you really feel like you deserve, some sort of treatment, if you deserve, to go in that direction because you really feel like in yourself it's going to make a difference, don't take no for an answer. Find that yes. I know people that have, and they're living their life cancer-free when people have told them that they couldn't. The other thing that I want to say is don't let anybody ever tell you that you can't do anything. And I don't feel like that's cancer specific. I just live my life in that way. Nobody has ever said you can't do something. And if they have, I've proved them wrong. So I want to make sure that everybody just remembers that you are your own person. You deserve to live. You deserve to be here as much as anybody else does. And just don't ever forget that.
Very good advice and a wonderful note to end on. Natalie, thank you very much for sharing your story. Dr. Lim, thank you as well for joining us today.
Thank you.
Thanks very much.